We're seeing a tendency, a trend upwards for COVID-19 now. The latest numbers this morning show that an 18% increase if you look at it over the last week. Are you concerned? Grand Prix weekend is happening in Montreal. Are you concerned about the no mask rules now at this event and the number of cases going up? And do you have any plans to address this?
Okay. First, let me just give you a context. First, we're not worried of the situation at this time, but we're following it. So I just want to make sure that we're on it. But what you need to remember, is that for probably the last 6 months, we make a difference with what we call the case with COVID or for COVID. And the reason I'm making this difference, now we have each day, probably about 60–65% of the cases that are coming into hospital that are with COVID. So the primary reason for those people to come to the hospital is because they have COVID, but this is not the main reason. So if you make the comparison at the same time last year, where all the cases were for COVID, or mostly, I would say mostly for COVID, we're exactly as the same place as last year. Is that clear? So for now, what we're monitoring is looking at what happened in the summer of 21, looking at what's happening in the summer of 22, and we are exactly at the right place. There is no increase of the cases that we call for COVID. Because when you're sick, you have a broken leg or whatever, you enter the hospital, and by the way, you've been affected. This is not as important because we're there you're there to have an operation because you have been sick, but this is not for COVID. You're with me? So it's very clear right now that what we're asking Dr. Boileau and his team is to say, are we at a different pace right now than last summer? The answer is no, we are the same place. And even if our measure of protection are lesser, because as you know, we were more restrictive last year. So this is encouraging. Now, what we need to do is to make sure that we monitor this for COVID. And I think the next point that I would say, during the summer, we've said, and we were talking to Dr. Boileau, I think on Monday night, it's clear that during the summer, we'll keep you updated, but the philosophy is to have a vaccination plan sometimes in August. I would say sometimes in August, because it's not are we going to vaccinate, the answer is when. And I think the global answer that I will give you, whatever happened during the summer, we'll have a vaccination campaign in August.
I don't know if you were riding the metro on the weekend. I was on the metro, and it seems that there's no enforcement whatsoever of masks on the metro. It's like it's already...
Yeah, but that's probably the problem when you announce a date, an effective date. We announce June 18, and people say, well, if it's good for June 18, should be good right now. It's a bit unfortunate, but I think that's what's happening.